How do doctors adjust epilepsy medication? Imagine trying to find the perfect balance on a tightrope. That's what adjusting epilepsy medication is like for doctors. They aim to control seizures while keeping side effects as low as possible. Every person is different, so treatment plans are tailored to each individual's needs. When doctors adjust medication, they consider how often seizures happen, their type, and how the person responds to the current medication. They also look at the patient's age, weight, overall health, and if they have other medical conditions. Blood tests might be used to check medication levels, especially if the person is taking drugs that need monitoring. Adjustments can involve starting with a low dose and slowly increasing it. This process, called titration, helps find the dose that controls seizures without causing too many side effects. If the current medication isn't working well or causes intolerable side effects, the doctor might switch to a different drug. Sometimes, adding a second medication helps if one alone isn't enough. If seizures are well controlled, the doctor might gradually reduce or stop medication, but only under careful supervision. Dose timing can also be changed to improve control or reduce side effects. For example, taking medication at specific times of the day might make a difference. When starting a new medication or changing doses, doctors watch closely. They check if seizures become more or less frequent or severe. They look for new side effects or worsening symptoms. Blood levels of the medication are checked if needed to make sure they stay within a safe and effective range. Sometimes, when a new drug is added, the doctor might lower the dose of other medications to prevent interactions. For instance, starting a drug like cenobamate often requires reducing doses of drugs like clobazam or phenytoin. Regular follow-up visits are essential. These visits help the doctor see how well the medication is working and if any adjustments are needed. Patients are encouraged to report any changes in their seizures or side effects right away. Remember, medication adjustments are always guided by healthcare professionals. They personalize the plan because what works for one person might not work for another. The ultimate goal is to help each person live their best life with fewer seizures and minimal side effects. Always consult your doctor before making any changes to your medication plan.